Hello, welcome to the Winnebago County Community Mental Health Board's Programs Year 4 through 6 Grant Seekers Meeting. For the upcoming grant cycle, you will find these grant documents located on the Winnebago County Community Mental Health Board's website, which the link can be found lower on this slide. Notice of funding opportunity, program years 4 through 6 for core programs. Notice of funding opportunity, programs year 4 through 6 accelerator awards. New strategic plan 2.0 covering program years 4 through 6. Funding opportunities timeline, funding policy, as well as other upcoming information and updates regarding the new grant cycle. Notice of funding opportunities, we'll go a little bit more in depth with additional information. So for program year starting in 2023 to 2024 for grant timelines, schedule of events. On the left-hand side, you will see the months and the dates, as well as for abstracts and new funding and then renewal funding. We will go into much more detail later in the presentation. Notice of funding opportunities have already been published, which can be found on our website. As of December 1st, grant seekers presentation will be hosted online. Applications will be open in Foundant. December 5th and December 14th are 2 Q&A virtual sessions. Should you watch this presentation and require additional information, please attend one of those 2 sessions. On January 5th will be the deadline for abstract applications. On February 7th, abstract decision notices will be given during the Winnebago County Mental Health Board meeting, which is an open meeting that is live streamed. New full applications requests will be announced at that meeting, and then renewal funding application deadline is also on that date. February 28th will be the new application deadline, and then April 3rd is when funding decisions for new applications and renewal applications will be announced at the Winnebago County Board meeting. May 20th is when contracts for those who have been selected for funding will be agreed upon. And then June 1st is program year 4 beginning for new funding and renewal funding. Mental Health Board recently approved a new strategic plan 2.0, which will cover the next 3 program years, and it can be found on the Winnebago County Mental Health Board website. For program years 4 through 6, for core programming, there's up to $60 million to be allocated over the next 3 years. For accelerator awards, which we will talk about later in the presentation, there are up to $10 million, $2 million per proposal over the next 24 months. And once that funding is allocated, there's no additional funding to be requested. For new program applications, the identified gaps are listed on the left-hand side. Applications are encouraged to strongly address one or more of these identified gaps. Target populations are listed on the right-hand side, all of which are outlined in the strategic plan with very in-depth information regarding how these individuals to be served and also defining these very specific target populations.
I will speak briefly to the Mental Health Board's funding policy. This is also posted on the website if you'd like to see the detailed policy. All of the funding opportunities fall under the Mental Health Board's funding policy. In general, agencies that are eligible to apply for funding may not have any of the Mental Health Board members as either an employee or a board member, governing board member of the agency which is applying for funding. You can see a list of agencies who are therefore disqualified on this basis on our website. If you are an organization that wishes to apply for funding but are disqualified due to one of the board member affiliations, please contact that board member directly and let them know of your intent or your wish to apply for funding. In terms of administrative requirements, lead agencies must have been established for at least 3 years. We do allow for private public and nonprofit agencies to apply for funding. And all agencies that participate are required to, for the core programs at least, required to participate in a learning network collaborative quarterly meeting for which serves the purpose of coordinating services across a system of care. Also to note, if you are providing services with mental health board funding, you may have eligibility criteria that is appropriate for your program, but you may not deny a client services based on their inability to pay. As I mentioned, organizations must be have been established for 3 or more years. In terms of other fiscal expectations, indirect cost rate can either be 10% de minimis, or if you have a state or federally approved indirect agreement, you may use that for your indirect rate, but then you must follow all of the appropriate rules that were established as part of the indirect agreement. And we will ask for a copy of that with any details about what requirements you have for itemization or otherwise. If you select 10% de minimis, you do not have to itemize indirect expenses. Also, when a fiscal agent or lead agency is utilizing an additional service provider through contract or through partnership, we do expect the fiscal agent to maintain compliance and appropriate financial documentation consistent with the funding policy. We do allow for that to be done as a partnership where each agency has their own budget for personnel, etc., or through a contract wherein the lead agency may contract for those services directly to the partner agency, or in this case, that would be a subaward. If an agency is using a subaward, we expect and require that you follow your own procurement policies for how that contractor is identified and contracted for services. For the actual decision-making process, mental health board members will be the grant reviewers, and they will do the scoring of applications, and ultimately they will also be the deciding body that will vote on decisions in open public meetings. We at Region 1 Planning Council on the staff support side provide technical assistance. We answer technical questions about grant applications to ensure that you have the information you need to appropriately file an application, but we are not the reviewers of the applications, and we are not the decision-making mechanism for approvals of applications. For the purposes of the core programs, these are standard grant expenditure-based grants, meaning for money that is approved, dollars that are spent, you will ask for reimbursement on a monthly basis and submit evidence of expenses to support that, and then we'll be issued a check which will reimburse you for those expenditures. Monthly reimbursement, as I mentioned, is the default method for processing payments. If for some reason you are requesting an alternative method of payment, we can certainly discuss that, but in general, monthly reimbursement is what works best for all involved. And for renewal of applications, something we're doing a little bit different this year is that we are doing multi-year awards, which will include some 3-year contracts for programs that potentially have established long-term demonstrated success and compliance. For other programs where maybe they're a little bit newer in the process, or there's been some bumps along the way, we may do 1-year contracts that can be renewed for up to 3 years total Renewal will not be a guarantee, but there will be a renewal option that the board can execute that without making a new funding opportunity where everyone has to reapply. Contract amendments can happen throughout the program years. Contract amendments may include things like a work plan amendment where there's going to be changes in personnel. Some of those things can be done at the discretion of the board president. Other contract amendments, such as budget amendments, things that require changing of dollars, will require a full board vote. We do allow for changes in the budget at the discretion of the funded agency for up to 10% of a line item or $3,000, whichever is more. Any line item changes in the excess of that or creation of new line items do require a budget amendment request to the full mental health board. For reporting, there's a few different types of reporting. There are quarterly outcomes reports that are required, which track not only numbers served, but some other types of impacts. And again, those are required on a quarterly basis. We do provide support and technical assistance for helping you determine how to collect that data and report it if you need that assistance. And finally, there is an annual report requirement in which we will gauge some additional input from your program regarding your program outputs and outcomes for that particular year. And then, as I mentioned, the financial reports are generally done on a monthly basis. And we operate on really what we call a best evidence system of reimbursement, where we try to be flexible with what is the best evidence you could possibly provide for an expense, rather than making it completely prescriptive, understanding that different agencies have different record keeping methods. If I could just make a quick note, because we are instituting accelerator awards this time around. While the core programs have this kind of long-standing, now well-established method of reporting, for accelerator awards, we may make some modifications to the contract types based on the project proposal. For example, if it is strictly physical capital, we may do a one-time payment into an escrow account and have a contract that is appropriate for that. We will make any contract modifications as we make decisions on those programs and determine what the best type of performance reporting and financial reporting is based on the type of program that is being executed. And we certainly will do that in consultation with the programs that are being funded for accelerator awards. In terms of the core programs, as we look at best evidence and reporting, we have identified really 4 categories based on 2 variables. The first of which is whether or not your program is revenue generating, and the second of which is whether or not your program is dedicated staff or not dedicated staff. So I'll start at the revenue generating. What that means is that in some cases, you are looking for funding to support an operation that also has some components to it that can generate additional revenue on a fee-for-service basis, or may have other grant funds that you're looking for matching funding. In this case, we do require that you report the additional revenue that's generated from other sources, and that needs to be documented. Especially with insurance billing, this can be a little bit complicated. So in our complexity matrix, that revenue generation does add a layer of complexity and kind of moves it from that left-hand column to the right-hand column. And then we do require things like some type of financial statement or actual billing statements that show revenue generated. On the dedicated staff side, if you have all of the staff working on the program are 100% dedicated to the program, then all we really require is a signed statement either by the staff or a supervisor that shows that all of the time on that project was spent on that project. If the staff is non-dedicated, meaning you have a staff that might be working on two different programs, maybe 50% of their time is on this, 50% of their time is on something else. In that case, we do require some type of timesheet documentation to show the actual amount of time that was spent on this project. So based on those two variables, it can become very easy to do financial reports or a little bit more complex. At its easiest state, if the program were not revenue generating, all the staff were dedicated, all that you would really need to provide on a monthly basis would be the signed statements that all the staff's time was spent on the project. If you have an indirect rate over 10%, we'd need the indirect rate agreement. And then we would need any invoices of additional expenses. So for supplies or equipment that's purchased, we would just want those receipts or best evidence to document the amount that was spent. We can certainly answer additional questions you have as it relates to this as you are writing your grants, or if you are awarded a grant, we can work with you on determining what is best evidence for your program. And with that, I'm going to turn it back over to Nicole, who will walk you through the actual grant application.
Okay, next slide. Okay, the grant portal for the Winnebago County Mental Health Board is called Founded. This is the link that is included here. In addition to on the website, you're able to access this. It's a very large button to access. And for accelerator awards, which we'll talk about later on, applications would not be allowed to be completed in Founded until you are contacted and given an access code. But for everybody else who are completing new applications or renewal applications, you would be able to utilize this URL as soon as December 1st. So on the next few slides, there's a lot of information. So we wanted to be able to talk to you about it in this platform, in addition to be able to have this for future reference. You can also find all of these dates and information on our Notice of Funding Opportunities located on our website. For new applications, these would be ones that are proposals that were not funded during the previous grant cycle. Applications would be accepted through the Founded Grant Portal, which we just included the link in the previous slide. And new proposals may have been submitted in previous grant cycles, but not received funding. December 1st, applications open in Founded. January 5th, abstract deadlines will be due as of 5 p.m. Central Standard Time. February 7th is the date that funding decisions will be announced at the Mental Health Board open meeting. February 28th would be for full application. So if on on February 7th, it is announced that a full application is requested, you would have your deadline be February 28th. And from that deadline, April 3rd is when all funding decisions will be announced for new applications in addition to renewals. New applications and renewal applications have a total of $60 million of total funding to be allocated over the next 3 years. As a result, this will be the most competitive grant cycle to date, as this equates to around $20 million of funding, which is the same amount of last year's allocations. New applications must focus strongly on addressing remaining gaps, which have been included on this slide in addition to previous slides. And any new applications to be funded could potentially mean reduced funding for programming that currently exists. So if you are an organization that already receives funding from the Mental Health Board, please be mindful of your ask to ensure that your current programming and new programming aligns as closely to the strategic plan the Mental Health Board has set out, in addition to addressing these remaining gaps. Renewal application are those that have been previously funded in previous years. And we encourage organizations to include up to a 5% ask in the application. So should there be a change in benefits or something like that, please include those in your ask. Renewal applications are to continue current programming as is. Exact staff that were previously funded, exact scope of work, all of the aspects as your previous years of funding is this application. If you would like to add additional staff, add additional scope of work, those would all need to be completed in an abstract application, or depending on the new change would be in the accelerator award, which we will discuss. Applicants will be asked to complete a year-by-year budget for the total 3 years of requested funding. The application for renewals opens in Fountain on December 1st. And there is an aspect in the application to be able to copy. So if there's a program description or different aspects of your application that have not changed, you are able to have a little bit more ease in completing that and be able to copy information from your previous year. We do ask that if in doing so and copying that you ensure the accuracy, so dates or amounts or anything that is in a previous year, if you're copying, ensure that's accurate. February 7th is the application deadline at 5 p.m. Central Standard Time, and April 3rd is when all funding decisions will be announced. Feedback that was received from the Mental Health Board was May got a little close to deadlines for new programming to start. So we have moved that deadline up to April 3rd to give organizations more time for starting off their programs. Okay, the next set of funding to discuss is accelerator awards. Funding is up to $10 million of total funding, up to $2 million per proposal to be expended within 24 months. Applications should focus on impacting human, social, or physical capital to increase the capacity of the mental health service delivery system in Winnebago County. The definitions and examples of human, social, or physical capital are all found in the Notice of Funding Opportunities. Organizations seeking this award must complete an interest in funding form on the Winnebago County Mental Health Board website, which will be available as of December 1st. If the proposal is aligned to the Mental Health Board mission, organizations will be contacted to complete an application for consideration. Once an application has been received, the application will be placed into one of these categories: ready for review, ineligible for review, or needs follow-up before review. All of the definitions of what these stages are listed here. They are also to be found in the Notice of Funding Opportunity. Accelerator awards are designed to be for new ideas that do not require long-term funding and can achieve financial sustainability within 2 years. Decisions will be based on eligibility, ranked score from accelerator champions, goals of proposal, and then a final board vote, which will happen during an open meeting. So the application process, just to break it down a little bit more, as of December 1st, as we stated, an interest in funding form will be available on the Mental Health Board website for completion. It's a very simple form that shouldn't take much time to complete. Once this form has been completed, organizations will be contacted for next steps if their proposal is aligned with the strategic plan. Organizations will be asked to complete an application through the grant portal, which cannot be done until you're given additional information. Applications, if complete, will then be provided to the Mental Health Board to review during their next scheduled board meeting. So depending on the timing, if an application is received 1 or 2 days before a board meeting, that would go with the next board meeting. We want to make sure board members have enough time to prepare for the discussion. And one option board members can request is for an organization to present at a board meeting. Should that be the case, you'd be given ample opportunity to prepare, to ask questions, and to get a presentation ready for that. Please note, once all $10 million has been awarded, there is no additional funding available. This funding is for new ideas, and it is first come, first serve for awards. Okay, grant review rubrics. Rubrics can be found on the Mental Health Board website inside the Notice of Funding Opportunities. These rubrics will be used as a guide in reaching funding allocations. The Mental Health Board reserves the right to not select a provider or to submit a new notice of funding for redefined services. Mental Health Board also reserves the right to enter negotiations with selected providers for all or part of the proposed components based on selection criteria. Overall program improvements for renewals. So these aspects of the rubric only apply to programs who've received funding for more than 1 year. So different areas of programming that will be evaluated is how well did programming, staffing, outcomes, individuals served, processes, and budget utilization improve over time. So in grant applications, there is a space to talk about what you have previously learned in other grant years. So you can utilize that section to be able to discuss how your programming has changed over time, or things that you have increased or improved or utilized in different ways over time. Okay, lastly is contact information. So if you have any questions you would like to email, the email is included here. You can also go on the website to subscribe to our email listserv, which has updates and different information about board meetings coming up and other mental health board activities. And here's some additional socials to follow, as well as YouTube, and find information about our upcoming grant seekers meetings on December 5th and December 14th. Also, a page to utilize is the funding resources page. So on the mental health board page, it's a very specific page for those who are completing applications, want to be able to access any of the documents we've discussed today, budget templates, all kinds of different information that will be very valuable in your endeavors. Thank you so much for attending our grant seekers presentation, and good luck on your grant writing.